Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about Parkinson's disease with Dr. Marwan Shuayto. Dr. Shuayto, how do you diagnose Parkinson's?
Mainly, Parkinson's disease is diagnosed with a good history taking and a very good neurological examination. There's no specific blood test, there's no other things that are very easily diagnosed. Parkinson's disease is much more difficult, especially early on in the onset of the condition. Now we can do certain brain imaging to rule out other things, like we do a CAT scan of the brain or an MRI of the brain to make sure there's no tumors or certain strokes that have affected that part of the brain. More recently, there has been some advancement in very specific CAT scans. There's SPECT CT with DAT scan. This is something that's available at McLaren. And what this does is it looks at certain parts of the brain with specific dopamine concentration. So when there's less dopamine, that is picked up by the scan. And as we spoke, that's the main cause of Parkinson's disease, is a reduced production of the dopamine.
Can Parkinson's disease be cured?
There's no cure for Parkinson's disease, but this is not anything new. I mean, there's no cure for anything in medicine. People think, really, there's no cure? But come to think of it, is there a cure for high blood pressure? Is there a cure for diabetes? Even something as simple as, high cholesterol. There's no cure, but there are medications to help control those symptoms and in effect, prolong life. So no, there's no cure for Parkinson's.
What are the treatment options for Parkinson's?
Medication, oral medication is the mainstay of treatment. Obviously, physical therapy, speech therapy, and occupational therapy play a big role in the treatment of Parkinson's disease, and it's long-lasting. And lastly, there are surgical options for patients who are refractory to treatment or patients who are on maximum doses of oral medications who are still experiencing significant motor side effects.
Well, let's start with the medications for treatment. How do those work?
So there's different classes of medications, and each class treats Parkinson's symptoms differently. The first line of choice is usually medications called dopamine agonists, and these are, for example, Requip or Mirapex. These are medications that sort of stimulate those lazy cells that are not producing the dopamine, and it makes them produce more dopamine. Now, as the disease progresses and more of these neurons die off, obviously there's nothing to stimulate anymore, so these medications become less effective. Then we use the second line of treatment, which is L-Dopa. L-Dopa is a chemical that our body naturally breaks down into dopamine, and this is in a medication called Sinemet. This brings on more side effects, unfortunately, because a lot of the L-Dopa is converted into dopamine in our body, but we don't want it in our body, we want it in our brain, where only about 20% of the taken medication actually crosses what we call the blood-brain barrier. So only 20% of what we take actually gets to the brain. So there are some side effects with Sinemet. The next line of treatment would be something like an MAOI or MAO inhibitor. Something like Azilect. And the way Azilect works is it helps decrease the breakdown of dopamine. So when we do have some dopamine, the concentration remains somewhat higher because we're reducing its breakdown.
Now, if the medications are not effective, what are the surgical treatment options for Parkinson's?
Well, there's a couple of surgical options. Actually, a while ago, surgery used to be done much more frequently than today. But as advancement in pharmacological options have occurred, we obviously now use more medications. Surgery is now used only on patients who are unable to tolerate medications due to severe side effects, or patients who have been on medications for years and years and years, and now they've become ineffective and their symptoms are significantly affecting their normal daily activity. The two surgical options, the first one is probably a deep brain stimulator. This is less invasive. I mean, it sounds invasive, but it's less invasive than actually the second option, What a deep brain stimulator does is it sends electrical impulses to certain parts of the brain that we need to stimulate in order to reduce the motor symptoms of Parkinson's disease. Surgical options have no effect on the neuropsychiatric symptoms. These are mainly the motor symptoms. And then the second option would be actually creating a lesion in certain parts of the brain, or actually removing a small part of the brain that is hyperexcitable and creating some of the Parkinson's symptoms.
Are there any new treatments on the horizon for Parkinson's coming in the near future?
Well, more recently, from a pharmacological standpoint, there has been something that has helped us a lot, which is a medication called Nupro. Nupro is a dopamine agonist, like we talked about in the beginning, so this is a first-line treatment. But the nice thing about Nupro is it's available in the patch form. So one of the main symptoms of Parkinson's disease is difficulty swallowing. So imagine not being able to swallow your pill. Now that medication comes in a patch form.
Dr. Shuayto, this has been great information. Do you have any closing comments for our viewers?
Well, just that Parkinson's disease is difficult to diagnose, mainly in the early onset of the condition. But a good physical examination and certain imaging can help us with the diagnosis. And diagnosing early is important because treating early is also important. So just for patients who have been having these symptoms that we discussed today, to contact their doctor and discuss these symptoms with them.
Thank you for joining us today.
Thank you for having me.
Stay with us. We'll be back after the break.